Joining us now on the program is Kimberly Kleinhans, Development Director at American Indian Health and Family Services of Southeastern Michigan. It's a nonprofit that's providing a community wellness center with approaches including traditional Native American healing as well as modern contemporary Western medicine. Kimberly, thank you for joining us today.
Thanks for having me.
Appreciate having you on. First off, just give us a little bit of background on the services that are provided by your organization and who they are available to.
Yeah, sure. So the services we provide include medical, mental health, community wellness, food sovereignty, youth programs, cultural services like sweat lodges and traditional medicines. We offer the community resources when they are available, such as having a backpack giveaway, giving out food boxes, or PPE and sanitizing supplies. We also have a COVID clinic and do COVID testing and vaccines.
And what are some of the tribes locally that you serve through the organization?
Well, there are almost 50,000 Native Americans in our 7-county service area in Southeast Michigan. Some are from local tribes, but many came here in the 1950s as part of a government relocation program. We serve about 2,000 Native Americans as well as other underserved individuals. The top 10 tribes we serve are Sault Ste. Marie, Little Traverse, Oglala Sioux, Pokagon, Little River, Saginaw Chippewa, Grand Traverse Bay Band, Navajo, Cherokee, and Eastern Band of Cherokee.
You can find more information on their website, my apologies, aihfs.org, or go to sharedetroit.org as well. To find more information, go to the Find a Nonprofit section and search American Indian Health and Family Services of Southeastern Michigan. You can also call them at 313-846-6030 Monday through Friday, or send them an email, info@aihfs.org. And Kimberly, let's dive in a little bit more into some of the resources and the programs that are provided. You mentioned that it's some of the traditional medicine, medical approaches from Native American history, but also some other services, including mental health, which is such an important thing to be providing services for, especially in communities like Native American communities where there is so much to discuss that needs to be culturally competent as well. Can you tell us about some of those mental health services that you provide through your organization?
Yeah. So all of our services are Native centered, and we utilize Native medicines in addition to Western medicine. We have 3 suicide prevention programs for different age groups, and suicide is a really big epidemic in the Native American community. So it's really important that we're able to have these programs. We have behavioral health therapists on staff as well as a psychiatrist. And we integrate Native American cultural groups such as monthly Indigenous drumming and sweat lodges, as well as men's and women's groups and a Native-focused recovery support group.
And how do these all incorporate together to create a better sense of both individual health, but also community health for our Native American community here in Southeastern Michigan?
Yeah, so Native American tradition, the community is really important. There's a pretty good, like I mentioned, there's 50,000 Native Americans in Southeast Michigan, and it's really important to work with the whole community because the community is really important for individual health.
More information can be found on their website, aihfs.org. It's aihfs.org. You can also find them on sharedetroit.org by searching for them in their Find a Nonprofit section. Call them Monday through Friday, 313-846-6030, 313-846-6030. And something that is mentioned on the website, and we've talked over a couple of times, is how the organization integrates traditional Native American healing and spiritual practices, but also combines that with contemporary Western medicine. How does your organization approach that to provide whole healthcare to your individuals that you're serving, but also addressing the issues that they are going to you to address.
Yeah, so we have 3 doctors on staff. 2 of the 3 are Indigenous, and all 3 are experienced in working with Native American community. We have a cultural services coordinator on staff who is based out of the behavioral health department, but also works with all of the community here. And we also, you know, we're our patients are about 40% Native American, and the rest really reflect the community here in Southwest Detroit. We have staff members who speak Arabic. We have staff members who speak Spanish. So we're really able to serve the community in a very inclusive way.
We're joined by Kimberly Kleinhans on today's edition of the Megacast from the American Indian Health and Family Services of Southeastern Michigan. She is there where they serve as the development director for that organization. You can find more information in a couple of different places. ShareDetroit.org is one place you can go to find them and over 300 other charities and nonprofits across Southeastern Michigan. You can also find them on the website AIHFS.org for direct information and links to resources as well. And something that's really important, Kimberly, through all this, and what's great about the work that your organization is doing, is that it's providing a wide range of care that's also bridging societal gaps in culturally competent care, because as you said, over 50,000 Native Americans in our local area and the number of different tribes that you read off at the beginning of the interview that you served, those all have different cultures of their own, different traditions of their own. And unfortunately, there is a lack of that kind of care available across the union, but also here in the state of Michigan. So how does your organization help to then bridge some of those gaps and provide this culturally competent care that maybe isn't as widely available as it should be?
Mm-hmm. Yeah, so because we serve a wide variety of tribes, there's a wide variety of tribal traditions that exist in North America. We're located mostly in the Anishinaabe territory, but like I mentioned, people have come here from other places. So we bring in elders that can teach and do ceremonies from different traditions. So we do have Anishinaabe elders, as well as Lakota elders, and other indigenous elders and teachers come in. So we can really uphold and respect all the different variety of traditions there are in the Native American community in Southeast Michigan.
More information can be found, of course, on their website, AIHFS.org. That's AIHFS.org, or call them Monday through Friday. Their number is 313-846-6030, 313-846-6030. You can also send them an email, info@AIHFS.org for more information. Kimberly, tell us a little bit about also your Little Dreamers program and your Dream Seekers programs as well.
Yeah, we offer 3 youth and young adult programs that are tailored to each specific age group. They each have age appropriate activities for Native connections and healthy lifestyles. The Little Dreamers is for youth ages 5 to 10 and focused on developing their interests and strengths in various subjects. Little Dreamers is an amazing place to begin learning through fun and engaging activities. And then our Dream Seekers program has been around since 1992, and that's for ages 11 through 17. They have been building a positive support network for Native youth and families while exploring ways to live healthily and break the cycle of drugs, alcohol, tobacco, and violence. So we try to, like other services that we have here, our youth programs focus on balancing the physical, mental, emotional, and spiritual needs of the participants.
We're joined by Kimberly Kleinhans, Development Director at American Indian Health and Family Services of Southeastern Michigan, on today's edition of the Megacast. Give them a call Monday through Friday for information on programs and resources, 313-846 6030. You can also learn more information about their COVID-19 resources, medical and behavioral care, cultural and community wellness programs, and more by visiting their website, aihfs.org. Kimberly, in terms of what the community can do to help get involved and help support these programs that your organization is undertaking on a daily basis in our community, what are some of those ways that people can get involved, either through, of course, donations or helping to bridge some of those needs, address some of the needs of your organization, or by volunteering to help as well?
Yeah, so donations are definitely integral to our ability to serve the local urban Indian population. We have a donate page on our website, and you can also donate through the Share Detroit website. As far as volunteers, in warmer weather, we're always looking for help with our garden work days, as well as volunteers are needed for our summer youth program. And you can email volunteer@aihfs.org or contact us through the Share Detroit website.
More information can be found on their website, aihfs.org, or as Kimberly mentioned, also sharedetroit.org, another place to go to find more information on this organization, as well as over 300 other charities and nonprofits across Southeastern Michigan. You can learn a lot from these organizations right there on sharedetroit.org. Go there, find a nonprofit section, search for a local nonprofit of your choice, or for our subject today on this interview, the American Indian Health and Family Services of Southeastern Michigan, and learn more about their programs and learn more about getting in contact with them, volunteer opportunities, donations, and more. ShareDetroit.org, the place to go for all of that. Kimberly, before we let you go, anything else that we should know about American Indian Health and Family Services of Southeastern Michigan at this time?
Yeah, I have some good news. We recently bought 5.3 acres from the Detroit Land Bank near the intersection of Michigan and Livernois for a new facility. We're going to expand and increase what we have to offer, including more dental, pharmacy, and imaging, as well as having enough space to host our annual powwow there rather than renting space from the city. We had a land blessing last August and are looking to start construction in the next year.
Well, that is great news, and certainly a positive thing for us to look at in our community, especially in the Native American community in Southeastern Michigan. Kimberly, thank you so much for telling us more about these programs that are available to the Native American community here in Southeastern Michigan, and going into some detail about what exactly is provided. We appreciate it.
Oh, no problem. Thanks for having me.
More information can be found on their website, aihfs.org. Call them, 313-846-6030, Monday through Friday, 313-846-6030, or send them an email about information or any questions you may have on their programs, info@aihfs.org, or go to sharedetroit.org as well for all of that info.